The leading cause of death for women is heart disease, and it's not cancer. Heart disease is much more common.
On March 31st, 2010, that morning I took a 3-mile walk with my friend. During that walk, I felt a little out of breath. I felt a little lightheaded, a little nauseous, so I started off for the ER. Seconds after arriving at the ER, I had experienced sudden cardiac death.
As a woman with heart disease, you're probably on several medications, but it's always important to remember that your treatment and your adherence is going to result in better outcomes. You're going to feel better, live longer, and have a much better quality of life.
I got a wake-up call when I was 52 years old. I would go out and try to mow the lawn, and I couldn't even start the lawnmower because I just didn't have any energy, and I'd come back and I'd lay on the sofa. And so I went to the doctor, and sure enough, I had a blockage of the LAD, which is the main artery down the front of the heart. I didn't realize the importance of taking medicine.
Every patient has their own specific medication plan. If you don't adhere to your plan, you may very well have a more rapid progression of coronary disease that could lead to a heart attack. You could develop heart failure. You can shorten your life.
I want to live a few more years, and I think by cooperating with my doctor and seeing my doctor on a regular basis and taking my medicine as prescribed and being aware of my body and trying to eat right and exercise and keep the stress down, that this is all going to help me to live longer.
The 4 key aspects to taking medications are the right dose, at the right time, the right way, and for the duration that it's prescribed. You should always carry a list of your medications, and that includes the dose, the size pill that you take, and how many times a day you're taking it. It's very helpful to go to just one pharmacy. That way your pharmacist knows all of your medications. They can also check for drug interactions, and they can advise you as to what over-the-counter medicines are safe to use and what over-the-counter medicines you perhaps should avoid. The most important tip for good medication adherence is communication.
Through communication with my cardiologist, I learned how important it was to adhere to my medications. I know now what those medications are doing for me and how they help me and how important it is to adhere to the schedule that I need to be on.
I think it's very helpful to have a pill box. So depending on the medication regimen you have, there are pill boxes where you put all the pills in for each day of the week. Or if you have a more complicated regimen, you can get a pill box that has each day of the week and then kind of morning, afternoon, and evening doses.
I do use a pill box. At the very beginning, I made them part of my daily routine because I knew how important that was and how important it was not to miss a dose. So making it part of my daily routine, I really do not find taking my prescriptions to be very challenging.
Good morning.
Good morning.
When you go to your appointments, you need to be honest about how you're taking your medications. If you are prescribed a regimen and it's just too complicated or it's too expensive, you need to let someone know, because pills don't work if you don't take them. And it's very, very important for your provider to know some of the obstacles that you're facing in terms of trying to adhere to your medications. It's been estimated that 1 out of every 5 prescriptions, or 20% of new prescriptions, don't get filled. Now, it's also estimated that about 2 out of 5, or 40% of medications, are not continued if they need to be continued indefinitely, that by the end of 12 months, almost 40% of people have stopped taking their medications.
My role in my heart disease is to take charge of my heart disease and to be compliant with my diet and exercise plan and to stay compliant with my medication. It is a partnership with my physician, and he gives me advice on these things. From there, it is my job to be compliant so that I can take control of my heart disease and I can have better outcome. Even after heart disease, you can live a full life.